Okay, which of the following should be the pediatrician's first step in addressing these concerns? Contact CPS, counsel the mother on proper nutrition and safety, prescribe a multivitamin and schedule a follow-up visit, refer the child to a psychologist, and refer the family to parenting classes. This is a 4-year-old boy brought to the pediatrician for a routine checkup. During his visit, it's noted that the boy has not gained weight during the past year and his height is below the third percentile for his age. The pediatrician also notices multiple bruises and abrasions in the child's extremities. The mom appears disheveled and disinterested in her child's care. The multiple bruises and abrasions is particularly I mean it's context CPS. The multiple bruises and abrasions is a potential for any sort of abuse. And then the idea that the mom's disheveled and disinterested is also like a concern for neglect. But
Sure.
either way, you would contact CPS.
Yep. Good. I know this sounds really obvious, but sometimes it's good to get the ball rolling, kind of to know when do you call CPS, right? When are you thinking about child neglect or child abuse, right? Because it can be hard on the test sometimes when they're giving you like a kid that has like osteogenesis imperfecta versus right somebody with abuse, right? So just keep that in your mind, right? Osteo imperfecta, right? You have a bunch of fractures that are random, right? That are random times, right? Child abuse, usually fractures, bruises, things like that. They're kind of the same cycle, right? Because usually they get, you know, bruised and things like that. But OI, you have the blue sclera, bone fractures and stuff like that. I haven't seen that question in a long time. Just keep in the back of your mind that they do ask OI versus child abuse. So.
Wouldn't you also get like hearing loss with osteogenesis imperfecta because like
Yep.
the fracture of the inner bones of the ear?
Yep, beautiful, beautiful, and that gets a little bit into ENT, which is my specialty. So I love that you mentioned that. So we on our boards get tested on hearing loss and osteogenic imperfecta. I would say on step one, not so much, I would say, but that's a great piece of information to know.